Well, good afternoon, everyone. I want to start today by recognizing the historic nature of recent days where, in an overwhelming margin in the popular vote, Americans voted for national leadership dedicated to decency, unity, kindness, and equity, and in doing so made history by electing the first woman, the first black woman, and the first South Asian American to the vice presidency of the United States. I'm really very, very proud to be a member of a party committed to building representation and a better tomorrow for all people. This wouldn't have been possible without the community leaders and organizers of all stripes across the nation, people of color and young people in particular, who secured the right to vote for themselves and their neighbors, who looked out upon this country's leadership over the last 4 years and said, I know we can do better than this. But today is even more about action than accomplishment, because the president-elect is a good and decent and empathetic man who comes prepared for national leadership with real plans to address this economic pain, to battle this pandemic, and to defend our healthcare workers, and when the time comes, to ensure that a safe and effective vaccine will be made available to all Americans. I'm so very pleased to see, as one of the president-elect's first acts, the announcement of a COVID-19 task force with experts committed to the sorely needed national action on this issue. Make no mistake, the weeks and months ahead in our fight against COVID-19 will remain phenomenally difficult. But specifically here in Illinois, we will persevere and we will continue to work with the federal government, soon with at least one fewer major impediment. On to our COVID-19 update for Monday, November 9th. As the weather turns cooler and more activity is driven inside, we may have a real problem on our hands. And the national experts at Johns Hopkins, Northwestern, University of Illinois, and other leading major healthcare institutions say it's only going to get worse. They've challenged Americans to recognize that we're at war and to act accordingly. Our new daily cases are up nearly 380% since October 1st. Our statewide test positivity is up over 180% in the last 5 weeks. And both our statewide COVID-19 hospitalizations and deaths per day are up more than 150% in the same time period. The virus is winning the war right now. The situation has worsened considerably in certain areas of the state, with massive increases in the rates of community transmission, specifically in 3 regions. As a result, regions 5, 7, and 8, that's Southern Illinois and Chicago's south suburbs and western suburbs, will join Region 1, Northwestern Illinois, in Tier 2 of our resurgence mitigations starting Wednesday. That means a prohibition on gatherings of more than 10 people for both indoor and outdoor gatherings, additional restrictions on sporting and recreational events, and tightened restaurant and bar table caps of 6 per party. The exact mitigations, if you want to read all of them, can be found on DCEO's website. Let me explain the severity of the trajectory in these 3 regions as starkly as possible and as specifically as possible, and I'll start with Region 5, Southern Illinois. Today, Region 5 is seeing an average positivity rate of 11.5%. In mid-June, that rate dropped as low as 1.3%, and on average today, more than twice as many COVID-19 patients enter a hospital each day in Region 5 than in late August, the summer peak. Regions 7 and 8 share in this unfortunate trajectory. Each now has a positivity rate above 13%, meaning just about 1 in every 7 tests in these areas is coming back positive. Per the WHO, the benchmark for reopening is no more than 1 in every 20 tests. Mitigations are only effective if they're followed. Too many local officials across the state are ignoring their local public health departments and doing nearly nothing to assist their residents in following even the most basic COVID-19 guidelines. Some elected leaders are allowing this continued rise in positivity to balloon out of control while taking no action. These mayors and city councils and county boards and state's attorneys need to take some responsibility for keeping their constituents safe. I promise them that responsibility pales in comparison to what could come when the hospitals in your area are filling up and there aren't enough nurses or doctors to save their constituents' lives. The end goal of mitigating the damage the virus is doing to people's lives is this: keep as much of our economy and our schools as open as possible in a safe manner, and when risk rates in the community surge up, take meaningful action to bring things down in order to protect ourselves and the people that we love. One last thing. If you see something, say something. If you see someone, a friend, a coworker, or an acquaintance who's not wearing a mask, remind them that it's for their own good to wear one. You care about them, and that's why you're nudging them. We have to look out for one another. This is one important way to do that. So thank you, and now I'd like to ask Dr. Ezike to give a report for the Department of Public Health. Doctor.
Thank you, sir. Good afternoon. What's the message? It's the same. Wash your hands, watch your distance, and wear your mask. I know it sounds like the same message, but we'll continue to reiterate the same message because it is these exact actions that will help us slow the spread of COVID-19. We all want an end to this pandemic. We are all on the same team. We want to be able to hang out with our friends. We want to enjoy our favorite restaurants. We want to have our large weddings and all the other things that have been sacrificed since March. But there's only a few paths to get us there. And one is by reducing the amount of virus that's circulating so that we no longer see sustainable spread. And we do this by limiting our group sizes as well as wearing our mask and keeping our distance. Unfortunately, there are a significant number of people who are not following this recommendation, and by not doing these things, the virus just continues to get ahead of us. It continues to spread, leading to more and more cases, more and more hospitalizations, and unfortunately more deaths. The other path is to have a vaccine. Let me not say that, not to have a vaccine, but to actually have vaccination. There is a difference. We can have hundreds of millions of doses of vaccine in the world, but if they don't get into the arms of people, it's not helpful. There are several different vaccines for COVID-19 that have been developed and are going through clinical trials. You may have heard of some recent updates today. There are people who are hesitant about a new vaccine and feel that the process has been rushed. The difference with the development and testing of the COVID-19 vaccine in comparison to other vaccines is that every possible resource has been thrown behind the creation of this new vaccine. The U.S. government has doled out billions to move vaccines through the requisite phases in record time. In fact, the whole world, not just our government, the entire world is focused on a safe and effective COVID-19 vaccine. The review of laboratory and clinical data that is used to ensure the safety and effectiveness of any vaccine is still being followed. And this includes review by the Institutional Review Board, which is a diverse group of clinicians, scientists, and community members. For people who want to learn more about the vaccine process, I urge you to research further the FDA vaccine approval process and look up more information from the National Institutes of Health. These are the paths that we are pursuing, and hopefully we can get to less cases, which means less hospitalizations and finally less deaths. Today, unfortunately, we're reporting another 10,573 newly identified cases of COVID-19 for a total of 498,500 560 total cases in Illinois. That includes reported additional 14 deaths for a total of 10,210 lives lost to this deadly virus since the beginning of this pandemic. Overnight, there were 4,409 individuals in the hospital with COVID-19, and of those, 857 were in the ICU and 376 were on ventilators. In the past 24 hours, 64,760 tests have been reported for a total of more than 8.4 million tests. So until we have a safe and effective vaccine in most people's arms, let's continue to wash our hands, watch our distance, and wear our mask. And just another reminder, because I know this comes up and I know there might be some confusion, if you are identified as an individual who was an exposed contact of someone who tested positive, running out and getting a test does not end the quarantine. You cannot test out of quarantine. So remember, it's still 14 days for quarantine after your exposure. It can take up to 14 days to develop the symptoms of the disease if in fact you caught it. And now I will translate the comments in Spanish. Buenas tardes a todos. Las mismas palabras, lávese las manos, mantenga su distancia y usa tu máscara. Sé que oigo como un disco rayado, pero seguimos con este mensaje porque sabemos que estas acciones pueden ayudar a frenar la propagación de COVID-19. Todos queremos poner fin a esta pandemia. Queremos salir con amigos, estar con la familia, cenar en un restaurante y todas las cosas que venimos sacrificando desde marzo. Pero solo hay un par de salidas. Una es de reducir la cantidad del virus en circulación para que ya no veamos una propagación sostenible. Hacemos esto limitando nuestras interacciones con los demás. Desafortunadamente, hay personas que no hacen estas cosas. Y al no hacer estas cosas, el virus seguirá propagándose, lo que provocará en más casos, más gente en el hospital y más muertes. El otro camino para terminar con esta pandemia es una vacuna, para recibir la vacuna en su brazo. Hay un par de tipos diferentes de vacunas COVID-19 que se han desarrollado y están pasando por ensayos clínicos. Sé que muchas personas dudan sobre una nueva vacuna y les preocupa que el proceso para una vacuna COVID-19 se haya acelerado. La diferencia con el desarrollo y la prueba de una vacuna COVID-19 es que se le han dedicado todos los recursos disponibles. Todo el mundo está enfocado en una vacuna COVID-19 segura y efectiva. Hay una independiente revisión rigurosa de los datos clínicos y laboratorios que se utilizan para garantizar la seguridad y eficacia de cualquier vacuna. Para la gente que tiene preguntas acerca de una vacuna, recomiendo que leas sobre el proceso de aprobación de vacunas de la Administración de Alimentos y Medicamentos y busquen más información en los institutos nacionales de salud. Estos son los dos caminos para prevenir nuevos casos, más gente en el hospital y muertes. Hoy estamos reportando 10,573 casos nuevos para un total de más de 495,000 casos aquí en Illinois. Eso incluye 14 muertes adicionales para un total de más de 10,200 vidas perdidas. 4,409 personas estaban en el hospital durante la noche con COVID-19. De ellos, 857 pacientes estaban en la unidad de cuidados intensivos y 376 pacientes estaban en los ventiladores. En las últimas 24 horas, más de 64,000 pruebas fueron hechas para un total de más de 8.4 millones de pruebas en Illinois. Hasta que tenemos una vacuna segura que está fácilmente disponible, lávase las manos, mantenga su distancia y usa su máscara. Muchísimas gracias para su apoyo. And with that, I will turn it back over to Governor Pritzker.
Thank you. Thanks, Dr. Ezike. Happy to take questions from members of the media.
Governor, can you talk about tier two? Because tier two really is not, there's some stricter rules of 10 people and that kind of thing. But you're really, tier three is when you're gonna shut down the stores and make it a lot tougher.
Yep.
When's that gonna happen?
Well, again, as you know, when we add mitigations, this virus doesn't react right away, right? That is to say that you put mitigations on, people have been exposed for days before potentially that you put the mitigations on, and you have to wait several days for people to show symptoms or to get tested or whatever. So that's why we say, you know, we give 2 weeks, sometimes 3 weeks, depending upon which mitigations we're putting on to see whether the mitigations are having an effect. Remember, you're trying to bend the curve. It isn't like you put the mitigations on and bam, 2 weeks later, everything starts dropping. Things are going up and they don't just immediately start going down. So you have to wait a couple weeks at least before you look at new mitigations after you've put new ones on today.
But to your point regarding that, Governor, Region 1 has been under Tier 2 mitigations for probably about a month now, and it's not helping. So, I mean, at what point do we say maybe these Tier 2 mitigations aren't strict enough and we need to start closing down these non-essential businesses?
Let's remember, it's not the mitigations that aren't strict enough, it's whether people are following the mitigations. So just to be clear about that. You also should remember, Region 1 has a very unusual situation that is extraordinarily unfortunate. They literally sit at the corner of Wisconsin on one side that has had 44% over the weekend positivity rates, and Iowa, which has gone up to 30-something%. Think about that as you're trying to impose mitigations and people following mitigations, right, to know that when you cross over the border that you're much more likely, 1 in 2 or 1 in 2.5 people, let's say, that you run into could potentially be infected with COVID. So it's a challenge, there's no doubt about it. And so we're working very hard with folks in Region 1 to get mitigations followed, to make sure that people understand there are consequences to not following them. Most especially, the biggest consequence is people are getting sick. So we're doing everything that we can to try to get that message across to people. We think that it's working in some parts of Region 1, other parts not so much. We do need people to listen and follow those mitigations, though.
Dr. Ezike just said you can't test out of quarantine, and I know
That's
you
right.
self-quarantine because of exposure to COVID-19.
Self-isolated, that's right. Yeah.
Before, but this time, I guess last Monday you were with some people from the Illinois restaurant.
Yeah, ironic, right? The same folks who are asking me to remove mitigations from restaurants are actually brought COVID-19 to my office.
Right, but the question is, why did you ignore IDPH and CDC guidelines?
I did not ignore those guidelines. You've got it wrong. I did not ignore guidelines. The guidelines are, and I can let Dr. Ezike, in fact, I will. I'll let the doctor tell you what the guidelines are. I followed them to a T.
No, the governor has, the team has always reached out in any time that we have identified a case, and we have followed even I've actually been stricter in cases to be overly cautious. I've probably put him on quarantine when we probably didn't have to, just to be abundantly cautious. In this case, there was an exposure on Monday. The person developed symptoms on Thursday and got tested, found out on Friday. So per CDC guidelines, if someone is identified, you go back 2 days from when symptoms began. And so from Thursday when the symptoms began, if you go back Wednesday and Tuesday, anyone that person was around on Tuesday and Wednesday, if they had more than 15 minutes of contact within 6 feet, those people would be the identified contacts. The meeting on Monday was outside of that period.
And outside of that.
Wait. You gotta explain that to me again, because
Sure.
I just have to do this, so
Okay.
I
I hope
okay.
you'll listen to an expert and a
Because
doctor.
it doesn't make sense to me,
Okay.
because he still didn't wait the 14 days.
No, hold on. I really want you to understand this because I think everybody needs to understand it because we're not done with this virus, and so everybody has to make sure that they understand. So when you identify a case, The confirmed case is the person who had the positive test that said, yes, you have been diagnosed with COVID. That person, when they develop symptoms, from symptom onset, when you go backwards, you go back 2 days. And all the people that the person was in contact with in the preceding 48 hours are now, if they reached 15 minutes, were within 6 feet, those individuals, so Wednesday and Tuesday, those individuals now will be contacts.
So, and I just want to be clear, I went and had a test done as well. Not only was I tested on Wednesday, as I regularly am, but also after we discovered this on Friday afternoon, late afternoon, was tested just out of an abundance of caution, because as Dr. Ezike points out, I wouldn't fall in the normal zone of contact tracing and isolating. But I just wanted to be extra sure because, of course, I'm exposed to all of you. I have a staff that I see every day and so on.
And that information is on the IDPH website, the information that you just gave.
It's on the CDC's
website.
website.
CDC. It's the
press release that
guidance
went
for
out
the
this
country.
weekend.
Governor, can I change topics?
You sure can.
Okay.
It's good to see you. I'm glad to see you're wearing a mask, too.
Thank you.
It's great.
Let me ask you about the overall strategy, the big picture, in contrasting the data in Illinois relative to the nation,
Yeah.
both on the COVID issue and on the economic or economy issue. There's a recent article from the Illinois Policy Institute by Bryce Hill that says Illinois had the largest increase in new unemployment claims in the nation in the week ending October 31, up 23,000 to 76,000 Illinois unemployment claims. And so you have new unemployment, and the new unemployment claims are going down nationally. So we're going up, they're going down. We're facing similar circumstances. And in October, the United States added 638,000 jobs. The unemployment rate nationally went down to 6.9%. And the nation had the biggest decrease.
Yep.
Illinois had Illinois jobs report from mid-August to mid-September.
Yep.
Had the biggest decrease in jobs in the nation.
Yep.
And then looking at the COVID issue, I think Illinois for quite some time has been within the.
Can we separate these, just so I can answer? It's a multi-part question, and if I may.
Well, just one more
Oh,
point.
okay, sure.
Ask the question whether they're related.
Happy to, yeah.
Illinois, I think for quite some time, I think for months perhaps, has been in the top 10 in per capita deaths across the nation when you rank the states. So we are the 10th, within the top 10 highest states in per capita deaths. Not close, but closer than Wisconsin, which has much looser restrictions, to places like New York and New Jersey that are very high, as you know. So do you think perhaps we need to shift our strategy that's more targeted, more thoughtful in terms of how you address the economic issues, and perhaps how you also target and address the COVID issues? I do have a follow-up, but let me give you a chance to respond.
Thank you.
All right, I don't know if we're gonna have time for that follow-up, so let me
Yeah,
answer that question.
well, that's 4 or 5 questions in there. Let's start with your supposition that our numbers are going up in terms of unemployment claims. Actually, what we've seen in those numbers, and I talked about this last week or the week before, is there's a massive amount of fraud that's been going on. We are detecting the fraud. But you have to have the incoming benefits claims come in, the unemployment claims come in order for you to be able to detect whether there possibly could be fraud, and then you've got to go investigate all of that. So that's that 1 week that you're talking about, and it was obviously disconcerting to all of us, so we're paying very close attention to that week. Second thing is the overall unemployment rate. Illinois has historically, and you can look this up, trailed the nation, both typically when unemployment goes up, and of course this is some kind of an emergency nobody's ever seen before, typically when it goes up, and when it comes down, especially when it comes down. We saw that over the last number of years as unemployment rate came down. Illinois came down, but it came down at a slower rate. Indeed, just before COVID, I hope you'll pay attention to this, I had been in office about 14 months, going on 15 months. just before COVID hit our economy, we finally had gotten our unemployment rate down to the national number. And I was proud of that fact and hoping that we could get below it, and then COVID
Was that
hit.
down to 3.5%?
3.4, I think, was the number, if I recall, but you'll correct me. But I know we hit the national number. So now, as to, managing the economy through all of this while we're managing COVID. The most important thing that you can do for our economy is to fight COVID, because the truth is most of the economic damage that's done here is done because people don't want to go to public places. Most people look outside and say, I don't want to go to a crowded place. They want to make sure that whatever they're doing, that it's being done in a safe fashion, whatever service is being offered, whether it's retail or dining or bars or whatever, right? They want to know that it's safe. Most of you, and there was a good article in the New York Times about this very recently, that even states that had no mitigation suffered tremendous downturn in economic activity for precisely that reason. Now, I believe strongly that putting in mitigations, and we're a big state that has a major city in it, so it's really not, it's not quite as relevant to talk about, let's say, a state that doesn't have a major city, right? I mean, we're much more like, New York or Los Angeles or, name the big cities around the country than we are, I don't want to pick on anybody, but, Madison, for example, right? Chicago has a much bigger footprint and number of people. And so when we had the major number of deaths that occurred early on, and nobody understood this, and I still think we don't fully understand this virus, you know that. But early on, we were trying very hard to slow down the virus. Even after we put a stay-at-home order in, you saw deaths rising considerably. And you saw the same thing in New York and in Detroit and in a number of other cities, and in some other places not. And nobody quite knows why. And everybody said, well, gee, look at Florida, look at the big cities in Florida, everything's fine in Florida for a long time. And then, of course, it happened to Florida in the summer, and then it happened in Dallas and in Houston and San Antonio and Texas and so on. So we don't fully understand how this virus works. What I do know is that my number one obligation is to make sure that we keep the economy going while we're keeping people safe, doing the best that we can. We shut down very early on our nursing homes in the state. And even though we did that and did temperature checks and limited visitation and so on, for those first 2 months, it was very, very challenging. We've now brought those numbers way down. We still have the occasional outbreak that is tragic in a setting with retirees. But actually, over the vast number of months since the worst of this back in the spring, we've done a much better job of managing through.
All right, we'll do one more question in the
I
room.
gotta
We
ask
gotta
you
get
about
online.
outbreaks. I gotta ask you about outbreaks. Because
Sure.
you promised information about outbreaks.
Yeah.
And at the end of last week, you posted online broad categories of outbreaks, but not individual locations.
Yeah.
Why are you not identifying individual outbreaks as other states do?
So those are identified by the individual local public health departments. We get all of our data from them, but they are the ones who are the repository of, if you want to know, what particular manufacturing location or what particular office had an outbreak, the local public health department would know
You
that.
gotta look further. Why not be more transparent and just make it a one-stop shopping? Look for
Okay,
it,
but I
find
mean, if you want to look at, you can look at county data. That's what what we're gathering is 97 local public health departments and their data in order to show what types of outbreaks exist in the state. Most important to us is to try to use that data to determine what kinds of mitigations or where can we be most effective at trying to keep down the numbers across the state.
And can you explain, maybe Dr. Ezike, the definition of outbreaks? Why did you change that definition to 5 or more?
So there are many more outbreaks if you do with two, if you do outbreaks that involve two cases or three cases. And so it was just in order to have the more sizable outbreaks, use the cutoff of 5 and are using that number so that we can show you the slightly larger, more significant outbreaks. Of course, if those two, if they grow and the additional cases get added on, it could get to 5 and then it would be put on there. But there would be many, many, many if there were just the twos. And so it was just to kind of show the bigger sized ones.
And remember, the local public health departments are the ones who first are notified about the numbers, and so they can jump on them when there are 2 or 3 if they want to.
All right, we're going to get online. We're going to get questions online. John O'Connor, given your experience with COVID, what caution do you have for the Pfizer vaccine efficacy news?
Well, I mean, as I've said all along, we're not going to distribute a vaccine that we don't know is safe.
He had one more follow-up. Biden is suggesting mask mandate and federally led testing and tracing. Do you agree with this? Would that take the burden off the state, or would it interfere with our state testing?
No, it would help our state. I've been calling for a national mask mandate for some time. Again, as I said earlier, think about the states around us and the fact that they don't have mitigations in many of those states, and that has an effect on Illinois, where we do have a mask mandate. And frankly, we do need help with testing and tracing, because even though Illinois is 3rd in the nation in testing, even the best state in the nation, and the 3rd best as we are, we need more. I mean, it's clear to me that what you really want to do is what the University of Illinois is doing. Testing twice a week, and whether you're going to know whether you have COVID pretty fast. When they get a fast result, you can test twice a week. I mean, if you could do that, we could isolate people much more quickly and therefore not have significant transmission levels.
But Governor, could you get those saliva tests to everybody?
That's what we're trying to do. Yeah, the FDA is holding up the distribution of those saliva tests, but that is absolutely, it was on the phone, in fact, over the weekend, trying to move the FDA along, because we really do need to do that everywhere.
Chris Kierkegaard at the Peoria Journal-Star. What specific concerning behaviors and trends have you seen in the Rockford area that are keeping their levels elevated? They've been under mitigation the longest. What's not working there, and what should other regions be doing to avoid their problems?
So the city of Rockford has done a better job, I want to say, than some of the surrounding areas. I think and I get these both anecdotally and in person when I've been there, people are less likely to wear a mask, who are the folks who are outside of Rockford, for example. And we need to make sure that state's attorneys and local authorities, mayors, city councils, county boards are taking this seriously. We want to make sure that people are following the mitigations, and if they would, I mean, this is true everywhere in the country and everywhere in the state of Illinois. If people will follow the mitigations, these numbers will come down.
Shia Politico, can you talk about the blue wave that wasn't? Why do you think so many congressional Democrats struggled, including Lauren Underwood, who's in a dead heat in the 14th district?
Yeah, well, I think Lauren Underwood's going to end up the victor in that race. Let me start with that. Look, I think, there were a lot of polls that were way off. The polling that was done in Illinois, I think most of it showed that Joe Biden would win by 20 points. And he seems to have won by 13 points, which is a terrific victory. So it's very hard to explain. I think there's a number of theories about this. Some of it is about an assumption on Democrats' parts that turnout, big turnout, was going to be, was going to happen, and that big turnout was going to favor Democrats. That's not true everywhere. There was big turnout in the battleground states. It wasn't true in Illinois. So I think there's a lot to evaluate about polling, that's for sure. And then, I think we're going to have to look back and see what happened in these individual races across Illinois to see whether it was a turnout issue.
Dan Petrella at the Tribune. Cases continue to rise unabated statewide and restrictions are being ignored. How much longer can you wait to take more decisive statewide action?
Well, I've been taking decisive action. I think you've seen these tiered regional approaches. This is the right way to go. Again, when people will follow the mitigations. But look, I'm very concerned as we approach Thanksgiving. I'm very concerned as these numbers rise. And as a result, as I've told you for days, we are looking at really all the possibilities, the possibility that we would have to go back a phase, the possibility that we would have to ultimately have a stay-at-home order. Those are not things that I prefer to do, but those are things that these numbers are not sustainable. But again, I guess one thing I look at every day is, are we bending the curve? As back in the spring we were doing. Are we bending the curve? And that doesn't mean that the numbers go down from one day to the next, but it does mean that the rate of increase is subsiding. And that's the beginning of flattening it and heading down.
Dave Dahl, WTAX. In Springfield, we've got a mayor and a sheriff who want to loosen your restaurant restrictions, and now we've got a sick fire chief. I guess he didn't get sick at a restaurant, but still, and he's the city's COVID officer. What do we make of all of that?
Well, I've been saying for some time now, we really need local officials to take this more seriously, to take some responsibility on their own shoulders. The idea that you're not going to enforce the mitigations, and then the idea that when it does get enforced, with a citation, let's say, that you're not going to, the state's attorney's not going to follow through on that. I know that locally they think that's, immediately good politics, but it's good politics for a very small, very loud minority. The vast majority of people want us to take strong action with regard to mitigations, and that takes responsibility at all levels of government.
A.D. Quigg at Crane, could you give us some insight into the meeting you had with the Restaurant Association? Why meet in person? Are you holding similar meetings with other associations? Is there even room for negotiation given that the mitigations are hard and fast?
I have lots of meetings. They're sometimes on Zoom, sometimes they're teleconferences, and sometimes occasionally they're in person. So they asked if they could come in to see me. We sat in a very large conference room. I was more than 8 feet away from the person who ended up turning out to be COVID positive. And I think everybody was at least 6 feet away sitting at the very, very large table. So why did I meet with them? Is that the question? Because I'm very concerned for the future of our restaurants and our bars. I know that these mitigations are very, very difficult on them. And in every stage of mitigation in every state, bars and restaurants are one of the first subjects that get addressed. Indeed, look at how well New York has done. And they had shut down bars and restaurants, I think, till September 30, and they still don't have bars open. And so there's some lessons there. I haven't wanted to, shut these places down. I've wanted to try to find some appropriate middle ground that will not spread the virus, and so that's what I'm always working toward.
Yvette Shields will be our last question. With the state's bill backlog up to $9.2 billion, underscoring the state's growing liquidity pressures, how soon will you announce the size and timing of borrowing through the Fed's MLF?
Well, we're in the midst of discussions with other leaders and both sides of the aisle, and want to make sure that we do what's appropriate for the state. But I will remind everybody that we have a significant COVID-related failure of revenues in this state, and so if the federal government, if the Congress finally gets around to a package that includes helping our local governments and our state, that will be part of the solution. But the other part is going to be significant cuts.
All right, thanks everyone.
Thank you. Jordan?